Hello, everyone, and welcome back to the Grateful Not Greedy podcast. My name is Kris, and I am here with my very naturally beautiful co host, and her name is.
Rachel, hi.
Hello, Rachel.
Yes.
Um, are you laughing already?
Yes. I'm I'm sitting here and you always look so like put together and I'm literally like hair's grown up, no makeup on, I'm like,
I
oh,
can promise you, I don't look put together, and the story I'm going to tell you, you're going to realize why I don't look put together. So here's my
oh,
story of the day.
which is interesting because from the outside, from here,
You
you
think
look
I look put
great.
together?
Yeah,
Yeah,
you
okay,
look
we'll
really put
pixel in.
together.
We'll pixel in a little later, you'll see. So my story is today's Saturday or Sunday. I don't know. Today's the
Sunday.
weekend. Okay.
Today's the weekend.
And 1 week ago, I had some plastic surgery. I went under the knife, as so to speak. I made a choice to get some stuff done. And I am a lady of a certain age, as everyone probably knows. And I thought, I've been in this recovery. It's so complicated because yes, I went under the knife. Yes, I had very specific reasons to do that. But even if I didn't, I don't owe anyone any reason, for the choices that I'm making, right?
Mhm.
But as I was going through this week and going through the recovery, and again, I'm a nurse, everyone knows this, it's not a surprise. So I understand recovery and I understand how that whole process works. And there's this whole kind of like roller coaster that you go through when you have like a procedure. So I thought, I'd really like to digest this with you today because there are so many issues that come up when you are a plastic surgery patient and when you're even considering being a plastic surgery patient or when you're looking at people in magazines or the Kris Jenners of the world or whatever who are on a magazine and everyone's like, oh, she looks amazing. I'm not saying she doesn't. I'm sure she does. But they have access to different ways to make them look amazing, right? Like there's
Yeah.
there's no question that every photo is approved, that we're not with them in their bathrooms, right? Um, so so yeah, here's my story. I have for years now, years. And I've had other stuff done. I have a connection to plastic surgery. I have been around plastic surgery for decades. Like I understand plastic surgery very well. I understand it on the reconstructive side. I understand it on the aesthetic side. I work in aesthetics. Like all that stuff is true. Um, so for quite some, probably at least 10 years now, I have really wanted to do my lower bleph. So it's a blepharoplasty, a lower bleph. So the surgeon will go in, a technically skilled surgeon. Please do your research and don't come and tell me that you found the best surgeon because he has a really good Instagram account. Please don't do that. That's a topic for another day. Um, but they'll go in, and basically what they're doing in a lower bleph is, as you get older, the fat pads are dropping and they're changing positions, and they're not where I would like them to be. So they go into an internal incision through the inside of the lower eyelid. So I have no incisions on me whatsoever. I definitely have bruising. I'm not bruising. I just have swelling. Go in through a little incision and then either take out a little bit of fat if you need some taken out. But really, it's about repositioning the fat that's there because you don't want to get too hollowed out or anything like that. And then part of that was also having a brow lift. So the brow lift part is facial aesthetics works in harmony. So I always tell people this. I'm like, don't, they're like, oh, I just want to get my eyes done. I'm like, that's great. If you can't see and you just want to get your eyes done because you can't see, great. If you're trying to get a different aesthetic triumph out of this, then listen to your surgeon, do everything in harmony and have things fit together. Because if you just do your eyes and Your brow is still dropped. Your eyes, you can see better, I guess. I mean, but there are optimizations. Let's just say that. So part of my experience was also getting a brow lift. In my case, it's an endobrow. It involves very small incisions, two very small incisions on either side of my head. And they take an endoscope down through your forehead, kind of through your temples. In this particular operation, they elevate the midface a little bit. And I did not have my upper lids done. So a lot of times people just do an upper and a lower bleph and whatever. Okay, so that's my surgery. And I have a whole vlog on it because I thought, here's what scared the crap out of me, Rach. I have been in surgery like around this field for a million years, right? So me, Kris, I'm on the internet, I'm on YouTube. How am I going to recover? Because the biggest reason that I have put off this surgery for so long, when I've been willing to do other surgeries, it's like, oh yeah, sure, I'll do a mid face, or yeah, sure, I'll do this little thing that I need to do with my breast, or I'll whatever. Okay, fine, I can fit that in, and no big deal. But the eye thing is, I was so worried that I wasn't going to be able to see for like 2 weeks. Like, I just thought, like, you see these people when you go and do a little bit of research on YouTube or wherever you do your research, and you see these vlogs and they're telling you how great their surgeon is and how great their experience was, and it's really not that bad. And when you know better, when you're in my position and you know that that's not necessary, and you know that that's not even half the times normal, it's hard. I mean, it's hard. So as I'm watching all of that, I'm kind of horrified because I watched this one woman and she did a great job. And I have great respect for people who do this, because it's a lot to give of yourself to everyone else so vulnerably, to talk about your procedures or talk about things that you want to have done, would consider, whatever it is. And she was, Rach, I think, both of her eyes were like baseballs. I mean, they just look like,
Wow.
Baseballs that have been at the end of the World Series the whole time, never replaced. Like super swollen. The bruising was outrageous. And, she was really sweet, talking just about her experience and about her, oh, my surgeon's so great. And, she was really lovely and told me like, this is normal, and this is normal. And she's like, and I'm really itchy on the inside, where my stitches are, and, like literally like bruising everywhere. So this conversation is so complicated for me because I have such a hard time when people with great intentions are misguided. And here I am, essentially an expert consumer in the field. I'm an expert provider, but I'm also an expert consumer in the field of plastic surgery. And to see people talking about their experience with normalcy in ways that I know in no way, shape, or form are normal. They're just not. They're just not. And yeah, so I have a whole experience of of course I have swelling, you have this, but if you have a surgeon who takes really particularly good care of your tissues and treats them respectfully, and everyone's different, everyone's body heals differently, everyone's going to have different issues, like, there's no panacea here, it's surgery. But there are ways really to mitigate the recovery. So I had that on Saturday. Sunday, was I chilling? Yeah. Monday I had a meeting. I had an online meeting, no problem. I literally, I was so worried that I wasn't going to be able to see. I planned all my tax stuff. I did every admin thing I had to do because I thought I wasn't going to be able to see for 4 days. And I thought I was going to be like super swollen. But instead of that, I'm like chilling. I'm just, I'm a little tired and whatever, just the normal
Yeah.
kind of like up and down of that ish. But yeah, so I have a meeting then. Tuesday I had a lunch something. I Wednesday cleaned my entire house this is like not advisable. This is what I was telling my surgeon. I'm like, when we talk about like you feel so great, so then you're like, oh, I just this little bench needs to get cleaned off. So I just did that, and then all of a sudden I'm in my closet, and I'm like, oh, I'm here. I might as well just do that. So I cleaned my whole closet, and I did. I mean, just literally everything, everything. Thursday I went to the office and did some procedures, did some
Wow.
work. Thursday night I went to my new mahjong, learn to play mahjong meeting with my neighbors who I don't know very well, right? So I'm showing up like looking however I'm showing up, and I just threw on my cute little hat and did my best. And they're kind of looking at you, but not like looking at you like you look strange. They're just looking at you because they probably don't know me. So that's Thursday. Friday, I forgot that I had a girls' night. So Friday, my girlfriend sends me a note. She's like, "Okay, you're good for the flowers, right?" I was like, "Oh yeah, totally, sure, absolutely, good for the flowers. What flowers?" So I had girls' night on Friday, and Friday, I have a very complicated. I filed my taxes on Friday, but for me, filing my taxes, and I'm still filing them. I still have to
Gosh.
finish it. It takes about 10 hours.
Mm.
So I did that all day Friday, and then did my girls' night, and then had my Saturday of chilling and whatever. And here we are. So let's talk about this because that that's my experience of
That
recovery.
is okay. That is so.
Right? And
Okay.
I mean, we all know
It's
that yes, I like to do stuff, whatever. But
no, no,
but
no,
I
no, no.
was able to,
You were
and
able to.
without flinching, I was able to. So
Yeah.
this is what people need to understand, and then we need to talk about all the other things about
Yeah.
the shame and the this and the
Okay.
that and all the stuff that goes with plastic surgery.
Here's the thing, like, okay, first off, I'm gonna say you are not normal. Your recoveries, like you bounce back from things like nobody else. I mean, I remember you bouncing back from childbirth. I remember you bouncing back from surgeries. Like you are like indestructible.
Maybe that's
And
true.
no, I'm gonna say this.
Well, but okay,
And
only the interjection is yeah, childbirth. Thank you, because it's true. I was like, it is true. I mean, 3 days later, I'm like, okay, yes, good, and I give everyone my secrets, and no one listens. So if
I
anyone wants my
did, I
secrets,
did.
yeah, you're the only one. You and one other friend. Literally, if anyone wants my secrets, of having 4 children and no tummy tucks, DM me. There's a system. It's pretty, easy. You just have to be disciplined, follow it. But the other point too, I bounce back because I have a good surgeon.
You do, and you not only do bounce back because you have a good surgeon, which I'm not like trying to minimize because I agree you have one of the best surgeons. And the other piece is you're going in healthy. You are going
Yes.
in as a
Oh, this is
healthy
such a good point,
candidate,
Rach.
which is a
Yes.
huge point.
Hmm.
And you also are going in knowledgeable. And I have to say, from my experience of having surgery in many different needs, like for medical reasons and for aesthetics, like I can tell you surgeons and like the office, they cannot prepare you for what you're
No,
about to embark on. The
no.
thing is you have the inside view, you're like the insider getting this done, so you
Oh,
have your expectations are totally set. Mine, I'm always like, what? What just
yeah.
happened,
This is so true.
and I have access to you too, right? Like
Totally.
I have access to lots of information,
Totally.
and
Completely.
it is
Yeah.
still like and I'm someone, I am like, I think you're on one side of the spectrum, I'm on the other side. Like I get hit hard, like whatever complication, it's here, like, and I am just really sensitive, and so some of that really, like I get triggered in a migraine that I never get it, and I like, I swell up, and like I have, anything around the face triggers my TMJ, like all of that is complex for me.
Oh,
And so
yeah.
my healing process, I have learned to go in with like zero expectations, and often I actually even needing to reset them, extending my time for recovery, like dialing it back more, finding subs longer for my classes, stuff like that I've learned that I just have to accept it when I'm in it, even though I didn't imagine it would be that way. And
Yeah.
that's
Yeah.
part of that process, is like you thought you might not be able to see for 2 weeks, right?
Oh, yeah. No, totally. Completely. Yeah.
Me, like I thought, okay, in like 2 weeks or whatever, I'll be back. And I was like, I am not ready to be back. So I have to reset my expectations,
Yeah.
because how we individually react and respond to these procedures, any reason you have a medical procedure, it is, we are all so unique beings, you know, and it is
Yeah.
dependent on who we are and
Yes.
what happens in the procedure, right?
Totally.
And so I want to be clear that like here, as we discuss this and want to discuss this openly and honestly, there is a whole gamut that can happen, and I look at you as like the model patient. Like, here's Kris, she's the model patient. Like, she's the one,
Yeah.
you know. And
Yeah.
then there's the rest of us.
Yeah, and there's the whole I love how you're saying this too, because it's like you're a yogi, right? You are an expert yoga facilitator, right? You have all the skills of, body function, understanding, hemodynamics, understanding body movement, understanding lymphatics, understanding all of that. So, that those skills go a long way in something like a surgical recovery. And when you're bringing this up, the question that's coming to me is, similar to our questions talking about being sick, is there some element of understanding, appreciation, and mental prep? Because we have talked about this so many times in our family that so often patients come into surgery as though they're getting a haircut. They think they're just getting a haircut. Like, oh, well, I'm just going to go to surgery, and who's driving you home? Oh, well, I was just going to, get a cab. Or, oh, my sister's going to come. Is your sister a nurse? No, she teaches kindergarten, but, yeah, we're going to be fine. You just don't understand. I don't care how small the operation is, or if I did it in office. We don't do in-office procedures, but some people do. Well, rarely, I should say. Some people, it's more of their bread and butter. But even those, you are locally sedated. You are not your own. You had your tissues moved around. Your hemodynamics in your body change. There are all these fluid shifts that are happening, and I think it's when you're a patient, you have to understand that you have all these. Now you've made the choice. No one, or at least for us selectively, no one dragged you in here and said, "Get on the table. Here's your rhinoplasty." Right? You made the choice. Part of making the choice is being responsible for that entire recovery. And I will say, having been a rhinoplasty patient, I always say to any rhinoplasty surgeon, unless you've had a rhinoplasty, it just kind of like step aside, because that recovery, it's different for everybody, but that recovery is real. It's on your face. There's a lot of nerve issues you're going on. There's bone manipulation that may or may not have happened. There's grafts that may or may not be in there.
Yes.
There's just a lot of stuff. It's way worth it. It's worth every ounce of suffering. Anybody who can breathe now would say that. It's worth every ounce of suffering. But yeah, I like your point, because yes, in this realm of surgical recovery, I do have a great advantage. I have probably an Olympian advantage of having been around it, seen it, done it, been there for other friends who've done it. I'm going to, be with some friends next week who are going through some stuff. I'm going to, usher them through this entire process, because I always say, for those of us who are involved in it, it's, we see it every day. It's like, okay, which case is coming, which case is coming. But for the person who's having it, that's their one of one or one of two, or, they're not having surgery every day.
Right.
So there's all this stuff that goes with it, and the health is, and what you're saying, because I didn't even talk about the things that I do on the daily this week to stay healthy.
Well, and before surgery, so I think there's two topics you hit on that I want to dive into a little bit more and pull the thread on. Is the first one is the prep, like what you're doing to prep, what you're doing to prepare yourself, and not just on the health level, like of like making sure you're not taking some supplements and taking
I
those
stopped
supplements
everything.
and
Yeah.
resting your body and like all of that for
Yep.
sure. But then
Yep.
the mental prep, and I remember you were talking about rhinoplasty, and I can totally agree. I had a bad deviated septum, and
Yep.
I needed to have it. Like, being a yogi and not being able to do opposite nostril breathing was
Yeah, same for me. It was running. Yeah, I
yeah,
couldn't
it
I
was,
couldn't run long
I
distances.
couldn't,
Yeah.
yeah, I couldn't get a breath in through my nose. And in yoga,
Hmm.
you keep your mouth closed 99% of the time. So it was like, it's like someone strangling me while I'm trying to breathe. And, but I remember before that surgery, mentally, it freaked me out because it is
Yeah.
a big one, right? It is
Oh
huge.
yeah.
And
Yeah.
there's, it's right on your face. It's like your airway, like all of that stuff is like terrifying. And I remember going through this process of visualizing and writing how everything was going to go that day to ease my nerves. And
Yes.
that is the mental preparation. So the
Yeah.
physical preparation, I like that is a key part, but there's a mental preparation. And for me, anytime I have a big procedure, when I had my knee repaired and stuff, sat down and I wrote all in detail that morning, how I woke up, how I got dressed, how I got there, how they greeted me, how I got
Hmm.
changed, how everything went, how I woke up, how it felt, like all of the things. I detailed it out because I wanted to, one, visualize how it's going to go, like to ease my mind,
Yeah.
and two, almost like manifest how that's going to go.
Correct.
And
And yeah, you're giving your mind the signal of what this is going
totally.
to look like. Yeah.
And I'm creating it, and I'm not creating anxiety, I'm creating ease in it.
Right.
And I'm someone who is like very afraid of needles, blood, like all of that stuff. Like it's not my jam. I am not the nurse here.
Am I allowed to talk about your Botox treatments?
I like pass
You're
out.
you're once every 2 years, Rach, hey, come on, let's just do a little Botox. Are you sure? I don't know.
Do you
Oh
remember that
my
first
God.
time?
Okay.
Like I was watching someone get it, and I basically went white.
Yeah, I
And
know. We have to watch for people
the doctor's
flopping.
like, "You need to put your head down." I'm like,
Well, yeah. It's just that's a funny joke, yeah, because it says
it
like,
is.
you have to remember to put your head back if you're one of those people. Yeah.
Yeah. So there's the mental preparation, but then, um, that is a key part of it, right? Like, because you want to walk in
Yeah.
mentally prepared, in your head, and you want to visualize like what is it you want, how do you want to feel, how you recover, like what that looks like, for sure in that process. And that is like for me, I don't want to walk in anxious, and I am like that. It makes me like having any surgery makes me anxious. Like it
Yeah,
just
I
is
mean,
like,
and rightly so.
yeah,
It's a vulnerable position. You're going under, well, often general anesthesia. You're relying on people to know their stuff big
yeah.
time. They're relying on you to give them accurate medical information that so they can help you. Yeah.
Yeah. So then there's the other piece that you mentioned, and I think this is like, I mean, I thank my lucky stars for you because you have been a part of my recovery team every time, right?
Yeah.
Like you've been there, and you're the one, and it's right. Like you're like, who's picking you up? How is that going to work? And even here, like when I was here and I had to have my knee repaired, I was like, okay, it's me and like my teenage son. He's not here to take care of me. So I like
Yeah.
literally, I had a friend move in with me for a couple days because I was like,
It's
I'm
the
gonna need
best.
help.
That's the best idea. Yeah.
Yeah, and it really made such a huge difference for me. But it's like who is on your team. So as you do your mental preparation before, you form
Hmm.
your team along with that. Like how's that going to work? Who's going to step in? How are you
Yeah.
going to receive and accept support if you need it?
Yes.
And like personally, like recovering at your house is one of the best places.
I run a very good aftercare here
I
at
know.
Chez Moi.
But people don't think about the aftercare. Like
Yeah,
it's you're done and they're like, "Oh, we're done." And I'm like, "No, no, no. There's like a whole process afterwards. Like the surgery is like one tiny little bit. The
it is.
before and the after are like huge chunks of how this goes." And you hitting on those things is really important as people look at this idea and this topic of whatever they're doing, whether it's medical procedures or purely cosmetic or whatever, is like how do you build the best outcome possible? How do you
Hmm.
put that together?
Yeah.
And and not just think I'm just going to get it done, it's going to be fine. Like
Yeah.
there's you need to, it's like when we had the conversation about being sick, like you need to give yourself time to recover, you need to give yourself space for that. And
In
how
this
do
way,
you do that?
especially. Yeah.
Yeah, unless you're Chris and you bounce back super fast.
No, well, but
But
even that, even that, I have to give myself more than 2 hours. Okay, it's a 2 hours recovery check.
yeah,
But what you're talking about is so important for people to understand because it's the real work begins when the surgery ends. Like your work begins. The surgeon's going to do a great job for you, I hope.
yes,
And honestly, please, for the love of God, DM me. I will help you find these people. There are surgeons who are better than others. There are people who are very skilled at this, and there are people who are not. Who you wouldn't let your operate on the dog, the rat at the lab. It's true. So there are big, expanses of skill, but that also determines outcome. That also determines outcome because my ability to flow through this is only made possible because I have one of the greatest nurse anesthetists on the planet. I have her. She's my requested person every time because I know that I'm going to wake up as though I just was in a little, dream. No, I just had this nice little dream. There's never one stitch of nausea. There's never one stitch of like, I don't feel awesome. There's never one stitch of like, oh, I'm groggy or I need to throw up or those things aren't normal. So everyone just needs to understand that is not the way it needs to be. So especially in elective surgery, you have options. So having said all that, yeah, for sure. But the prep after, okay, I would love to have the product, whatever you were talking about, your pre, like kind of what you did. Let's make that for people because I think that's a really relevant thing because it's not just like a regular journal where you're like, oh, I'm feeling great today. Da, 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 da. It's a very specific. It gets your mind aligned, especially if you've never had a procedure. It gets your mind aligned to what this is and gives your mind the mental space that it's going to take to do the recovery. And then, by the way, not be calling your surgeon's office every 12 minutes. Oh, this doesn't look. We're happy to have you call. Like you can call anytime, but it's also you don't need to worry. There's so many things you don't need to worry about if you're prepared for the process of what it's going to look like and what it's going to. We always want you to call rather than not call. But if you're prepared for the process of how it's going to go, and do not think that you can do this stuff on your own. This is one of those times where it's like, you don't be the hero. I say it to everybody. I just was talking to someone else who had a knee surgery and, well, I have these pain meds. I'm in a lot of pain. And I was like, hey, did they give you some pain meds? Oh yeah, they gave me, some this and that, obviously narcotics and then some, and people get freaked out. Like, I don't want to take narcotics. I don't want to end up being an opioid, addict. You are not going to be an opioid addict because those pain receptors have a place to go because you have pain. So when you have pain, you have a drug that's designed to find those receptors and attach to them. Guess what? You're not going to have pain anymore, and that's what they're designed to do. So you're not going to become an addict. The whole point about pain is the signal for your body to like that. Taking care of that pain is what allows you also to recover and to keep doing better and to go through the whole thing. So I would love to have we'll put it together. Yes, I would love to have your version of that. Because it's the like you said, middle and recovery. And by the way, some of these rhinoplasty patients, if you're a rhinoplasty patient, you're not in active recovery for a year, but your result is continuing for a year. And a lot of the procedures that I even do as in aesthetics as a nurse, the results keep coming for months and months because we're working on systems that keep renewing, collagen keeps coming back and whatever. So I would love to do that for people just to, show what's there.
And it's like, and it's not just the process of it. Yes, I can write out, like we can put together like how you write it up, but then you reread it every day, like multiple times a day. So you're like so familiar, and our brains are designed to fill in gaps. And when we don't have information, it tends to fill in the worst case scenario. So I fill in like every gap, like exactly what I'm wearing, like who's driving.
Oh, nice.
Like,
yeah.
Because then my brain has no space to put in random stuff that is not going to happen, that is more on a negative side. So, and then I read it and it becomes like, actually feels like it's like I'm now telling myself the story of how it's going to go. And I know all the details, which is great. And then to your point about pain, and I don't remember who told me this, but they were like, you stay in front of the pain. You stay in front of the pain.
Keep ahead of it. Yeah,
ahead of it, because once you're behind it, it's really hard to catch up. And I have to tell you, that was so true on many, and especially in knee surgery, like joint stuff. It is like
that's what this guy was dealing with.
Yeah, and it is, like this is not a time to be your own hero. This is a
Nope.
time to like lean in and be like,
No,
I
and
got
people also forget. I mean, we'll move on from the technical side of this conversation, in a little minute but there's so much more to talk about too. But the problem also that people don't understand is you're under anesthesia during your surgery. So you come out of your surgery and you think you're fine. And then you
yeah.
go home with your brother or your, kindergarten teacher aunt and not that they're not lovely people, but they're not medical professionals. So if you're not in an aftercare facility, or you're not with a nurse, or you're not with someone who understands this stuff, you might miss that first pain med because you're feeling fine, not realizing that anesthesia every minute is wearing off. That's the whole point. And by the way, you should be drinking fluids to get it to flush out of your system even faster. So, like this drug needs to be in you. Like this little pain pill needs to be in you, and then again it needs to be in you again, and it needs to be in you again, and you do that for a couple days, and then you can say like, all right, I'm done with the narcotics. Like you don't need to stay on them for a week. They'll give you a huge supply. You definitely don't need that for the most part. Most people don't. But yeah, not to be afraid of that. So
No.
what I want to bring everyone in on the conversation of this, especially in the grateful, not greedy side, because I also had anxiety about this particular procedure, and I'm not an anxious person in general about procedures. And I think this, because it's your eyes, and it's not like I wasn't at all worried about my eyes being whatever, but the eyes are like the key to your soul, right? And right, let
Yeah.
me just tell you psychologically kind of what went on
Yeah.
for me, because I'm not someone. I have a vanity space in my life too, for sure. Yeah, but it's all also built on working out and taking care of myself, and doing some peptides here and there, and like I'm an optimizer. I'm not a massive biohacker, but I pay attention to that kind of stuff. So the idea of also looking at your eyes is it's one of the my eyes are one of the things that I get complimented on.
Mm.
So now I'm looking at something that really bothers me, which are my little bags under my eyes. They're still kind of there, I'm sure, because I'm still there. I'm way swollen. I'm a week out. If ever when people just relax, if they're like, "Oh, she doesn't seem like she had her eyes," no, I mean, I'm a week out. But when you talk about changing, and this is a real thing, this is a real phenomenon that people also have to understand. So I had a little bit of anxiety about it just in general because my eyes are so fundamental to how people see me.
Yeah.
Like I literally I know that people have a reaction to me because I didn't pick my eye color. I don't have anything to do with it. Thank you, mom and dad. But for whatever reason, and I didn't want that presentation of me in the world to change.
Mhm.
And it wasn't even like, oh, her eyes are so beautiful. Some people just have these like striking eyes that you're just like, wow. I think mine is more like the soul. I think it's much
Right.
more
Yeah, I
like
agree.
soul. I don't. You can speak to it because you know me, but
Yeah.
I feel like people react to it. So there's that too when you're changing, and people go through this with their nose too, or their face or their breasts or whatever they have going on. I mean, there's all kinds of reconstruction things that people need to do or desire to do, to kind of have things to get more self-confidence, but in the same light you're in conflict a little bit too, because you know what you know, but you don't know what's going to be on the other side of it. And that kind of like plastic surgery blues, especially after things like rhinoplasty, this people definitely go through this. Maybe a
Hmm.
little bit for the face, but honestly, facelifts I feel like people recover pretty easily from. It's not an extremely invasive operation, other than the brow and neck lifts maybe if you're doing a lot of dissection. But I can talk to anyone offline. DM me. I'll talk to you for hours about that kind of stuff. But like the nose and things like that, where
Mhm.
it's really part of it, and you're worried about changing, and then you have that minute, or some people do, 2 days, 3 days, a week, 2 weeks after, where you're like, why did I do this? Why did I
Mm,
even hit this?
yes. Yeah.
And I will say, rightly so, if you are in the camp of having unfortunately chosen and trusted someone who did not bring their A game and does not have an A game,
Mm-hmm.
it's really sad and really unfortunate. And I'm not saying that to scare people. I'm saying that to remind people that your Instagram doctor is not the expert. The chief at your local university is not necessarily the expert,
Yeah.
right? That they're an expert in, they might be, but they also might be an expert in writing papers about fat transfer. You,
Right.
you just don't know, so it's really important to know how many of these they do. Well, what is their specialty? Do they understand all this stuff? I could talk about this to ad nauseum. I'll probably we easily could do a separate one. I'll probably just do it on my own. A separate one if people are interested in this topic, because this is something that I know a lot about. But what I want to get to is also the grateful, not greedy. Is it okay to have plastic surgery? Is
Mhm.
it incorrect to judge people for having plastic surgery? Is it okay to flaunt your plastic surgery? Because in my world, it's not. Like I can tell you, there are very few things that get me more get under my skin
Mhm.
than women who flaunt their breast augmentation results.
Mhm.
And I'm just going to say that. I'm just going to call that what that is. I don't.
Yeah.
I love the fact that, and especially for people who have reconstruction, and have real problems, because if you've been in rooms and you understand what women go through, some people have real problems and they've had real self-esteem issues since they were 12, because one breast is a D cup and the other one is an A cup, by example, stuff like this. There are those things. And then there are the other situations where I feel like it's so tempting to get into the I'm so proud of myself, like I love myself so much. There's a
Mhm.
fine line between I look great, I feel great, my self-esteem is sky high, and oh, too bad all you bi blah 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 fill in the blanks. You would do it if you would, if you could,
Right.
kind of stuff.
Right.
And that to me is obnoxious, and it defeats the specialty. It defeats women. It hurts the process of the progress that we make as women, especially, I mean, especially breast talk. I mean, it's like, come on, let's
Right.
like talk real shop, right? Um, so what about that? Because you look at the Kardashian family that we all know and love. Great, like I could not be more impressed with a woman who takes her family into an empire level like that. I mean, there's just the respect that I have for someone who can on a business level alone.
Yeah.
I don't know her. I don't know anything else about it. But on a business level alone, that you can make those decisions and make whatever choices, whatever, good, bad, ugly. I don't know. But to have those outcomes, but those are all plastic surgery results. Those are all that life is possible because of plastic surgery.
Yeah.
100%. Like without question, that's, the optimization of it is happening because of plastic surgery, right? And that's probably replicable in many other fields. Having said that, you will take a 15-year-old kid and you will get them a rhinoplasty that they have begged their parents for since they were 13, and 15 is kind of the age, right, where you can really think about doing it, where your bones are where they are, and you have changed that child's life. You have
Yeah.
changed, you have altered the course of existence for the rest of time for that child, because that presentation now, that that kid has all the confidence in the world. That
Mm.
kid is going out for student government. That kid is applying for the job at the yogurt shop. That kid is asking the girl or guy out, going to homecoming, doing, everything change. We see it all the time. Everything changes because now the signal is I'm okay. I'm okay.
Yeah.
I was getting bullied for this, or I was getting this, or it's, oh, but for her nose, or oh, but for his, no, oh, he's got such a big nose, or whatever the heck. So there's just a lot of complicated conversations, I feel like, in
Mm.
aesthetic surgery, and this is why I want to be responsible talking about mine, because I'm not ashamed of it at all, but I'm also responsible with it, and I
Mm.
feel a great responsibility for being of service to people rather than being of shame to people. Like, oh, don't, it'd be great. Wouldn't you love to get this too? No, no, yeah,
Yeah.
no, no. I want to be of service. Is it something you want to do? Is it a priority you want to make? Are there funds that you can take from something else to do this? This will, has the capacity to change your life. Do you want that? There's just a lot. Probably could have a whole separate job in just plastic surgery coaching because
Yeah, it
it is
is.
so
Because there's,
complicated. It's so complicated. So reflect on that for me because I want to support people also who maybe are, on the fence about it because of the shame of it. Because of
yeah,
what am I going to tell my friends that I had a procedure? And everyone, I'm sorry, you're saying anyone on the red carpet, they're all doing something. If they're not, oh, I've never done anything, I've never gone under the knife. Okay, they have expert facialists, they have lymphatic, whatevers, they have expert chefs, they have, everyone is optimizing them, or not, the people who are just like gave up. I mean, that's fine for them too. Like, but the people that you see that don't even look normal, attainable,
yeah,
it's because that's that's tens of thousands of dollars a month
yeah.
of maintenance. It just is.
It is. It is. And I think, you hit on it. It's like, what's the reason for you to be looking at this? And why are you approaching it? And the question is, are you doing it for you? Are you doing it for something that you want to see that is like makes you feel better as a person? Or are you doing
Mhm.
it because someone else said, or someone else was like, oh yeah, that's like, yeah, to balance yourself out, you should do that? And that's a slippery slope because then there's
Yeah.
always something next.
Oh
At
yeah.
least in my opinion, like that
Oh
is like
yeah. Yeah.
there's because we are not symmetrical beings. We are not, like we all have uniqueness to us. And the question is, it's like what is driving this for you? And if you think it's a person, if you took that person and moved them out of your world for a moment in your head, like would you still be considering this? Like would this
Hmm.
still be important to you
Yeah.
with or without that,
Yeah.
thing? And I can't imagine, your example of like the 13, 15-year old that, has a rhinoplasty, like, and those that absolutely can be life changing.
Life
And
changing. I
and
can
the
I
other
can
piece is,
attest to it. I see it every day.
yeah, and I'm sure you do. And I have witnessed someone who gone through it and they became a different person because of the confidence.
Hmm.
And to think like how amazing to do that at that point in their life where that confidence we're still building it so much at that point, and instead
Yes.
of like pushing it down the road when they finally have the ability to do it on their own in their like mid to late 20s, you're like there's a whole window of confidence and experience that they probably shied away from
Oh,
because of where they
definitely.
were. And
Yes.
so there's like um the so that's incredibly powerful. And then you're right, there's the shame piece of like I don't want people to know. Like,
Don't
they
want people
shouldn't
to know.
know,
Yeah.
like all of that stuff. And it's like, why not? Like,
Why not?
everybody knows that I work out, right? Right.
Exactly.
And
Yeah.
like, and I take care of myself. I like take supplements. I have someone who like looks at my blood work and like helps me understand my body. And like, you can do all of these things. And I was like, this is another piece of that.
It is.
Whether it's right for you or not, that's totally up to you. Just like some people choose not to do supplements, some people choose not to like lift weights and they do something else. Like there's all sorts of ways to approach this, and this is one of the pieces. And
Hmm.
all of them go back to what does this do for me? how does it make
Yeah.
me feel, right? Like I don't do yoga because like I feel like it like makes my body the way it looks. Like I do it because it feels really good and I connect to myself there and I feel really at home there. And like the side benefits are amazing, right?
Of
Like it
course.
makes me
Yeah.
strong,
Yeah.
it makes me
Longevity and
flexible.
everything. And yeah. Yeah. And you look great. Yes, of course.
And so, the question is like, why is there shame associated with that?
Right, because there's not a shame
And
with you doing all your yoga. There's not a shame
no,
with you. You can go out and lift weights, and it's totally why, because that's healthy. But the psychological benefits from plastic surgery are undeniable. They are undeniable as someone who's in it, who sees it. They're
yeah,
undeniable. So your
but
mental
it,
health is different from your physical health. Like what?
yeah. Well, but here's the thing, Chris, is then there's the other side of it too, right? Like
Yeah.
there's both sides to this. Like it is
I
undeniable
think
what
there's
I
like
can do.
32 sides to it. I
And
think it's
yeah,
like a
yeah, but there's
prism
like,
thing. Yeah.
the other side that we see is it becomes this like it's
Chase.
obsessive and like a
Yeah.
chasing and everything else. And so there has to be, and that's also true with working out. That's also true with
That
eating well.
is.
That's also true with all of these things. It
Yes.
happens everywhere. There's a slippery slope. And so that's where I think, the physical and mental preparation of like, what is this you're doing? Like, why are you doing it? What's it? And like, do you think will you really be happy at the end, or is it just going to be breathe the next and
Right.
the next and the
Yes.
next and
Yeah. Or are you
you
really
know
solving a problem? Are you looking for a solution for a problem that has a different solution? This is not the solution to the problem
e-
you're trying to solve. Yeah.
exactly,
Yeah.
exactly, and
Yeah,
spending the
like
time
I'm gonna
trying
change myself so that, my spouse won't leave me or whatever. And it's like,
right
don't, no,
find me more
don't do
attractive,
that.
like
Don't do
all of
that.
that stuff.
I can guarantee you that's a lose. Yeah.
Yeah, for
You
sure.
might want to leave them after, actually. That's more possible. That's more
Yeah,
possible. But yeah,
but it's a really it's a big topic, and if there is shame associated with it, like where does that come from for you?
where does that come? Yeah,
Like where did you pick that up? Did you pick that up? And I think especially you live in Southern California. I live
I
in
sure
Hawaii.
do.
Southern
Yep.
California, it's extremely normalized, right? Here, not as
It's
much.
normalized and it's also pressurized.
Okay,
It's
good to know.
also pressurized, I would say here. Yeah,
Okay.
and I think that is probably at the crux of why people would be reluctant to talk
Mm,
about things they have because as though your ability to optimize your look is somehow shameful, and
mm,
I'll just speak personally, whatever. I'm just a person with a mic, whatever. We've had this conversation before. I've been the most gorgeous woman in the room, and I've been the one of the least gorgeous women in the room. Like I've had the experience of life where I've had plenty of attention from people, like
mhm.
attractiveness wise, right? My whole life, not like this is not about plastic surgery. This is just
Right.
like about just being a person through life, whatever. Did I chase it? Was I like da da da? But I've also been, like literally on the same day, I can be in one room and be the most gorgeous person in the room. And the next, 2 hours later, I'm the least gorgeous for however you're going to qualify that, right? And especially in high
100%.
school, and people are so mean. And,
Yeah.
I grew up in the 80s when, we did all kinds of experiments with our hair that maybe weren't so, like looking back, maybe not the best choices, or people who have, like these big glow ups or they have these, teeth issues or something and then they get them fixed. It's like, of course you're going to get your teeth issues fixed, but you don't want to optimize your facial tissues, or you don't want to optimize your whatever, your neck, or if you have, men don't have breasts necessarily to deal with, women do. There are realities there. Men don't have children. They don't give birth to multiple children. There are lots of things that happen to your body there. That is a massive way to be able to take care of yourself. And I would say if you're one of those women, who's had children, who wants to, feel has somehow, because some women skate through the whole childbirth thing and the post and the first baby. Most first baby people will never, nothing will ever happen to them. Second baby people, usually pretty fine. Third one, that is the ticket. That is the ticket to your skin laxity. That is the ticket to your diastasis. That is the ticket to, things kind of like not exactly being, especially if you have them close apart. There's just a lot of stuff that goes on with your tissues. But, are you embarrassed about that? Are you, it's not okay to say that you had a tummy tuck because you gave birth to children, and you would like to, accept, of course, sure, accept your body. If you gave birth to children and you breastfed them all, and you want that experience to continue for the next 30 years of your life unaltered, have at it. But in no way should any other woman have to take judgment from someone for making a different choice. Like in no way should that woman ever have to take judgment from someone, or someone, my breast dog. Fine. Some people just have a preference for a certain size breasts. And in Southern California, the numbers, I just can't even, get my head around it. Honestly, I'm like, is that really even like a number in real life? But
Yeah.
people are into that. Okay, fine. But again, check yourself. What is that about? What's going on for you? Is there something else there? And even if there is, fine. If you understand it, it's all fine. Everyone's making their own choices. But it's just occurring to me this week as I am doing my recovery, so it's all these multiple things, right? I'm doing my recovery, making sure that I'm taking my zinc, I'm taking my antibiotics, I'm taking my all my support stuff, my arnicas and whatnot. I'm taking my mental load, I'm taking my little rests if I need to. I'm doing all those things, but first picking a really good surgeon, thank God, I have access to that. So, doing that first, but I wanted to talk about it because I want people to know. If you want to ask me what surgeries I've had, I will tell you. Yeah, I'll quote my brother-in-law. I love him. He's the most hilarious guy. So my brother-in-law, when I was doing this kind of stuff, and I had this, because this, you do the lower breath. The lower breath comes with the brow. If it doesn't come with the brow, then it's awkward. It's strange. You do a mid face. Then that comes eventually with the neck. It's just like it's one thing. It's another. It's whatever. And my sweet brother-in-law is like, that girl's had some work. If you know me, if you know me as a person, you know how hilarious that is. Like it's like the funniest thing that anybody could say about me. It's like, do I chase it? No. Like, do I love it? Yes. Do I think it's really great for people? Do I love that people get joy out of plastic surgery and out of aesthetics and feeling good about themselves? Yes, it's a passion of mine. It's a massive passion of mine. But so is reading. So is getting smarter. So is getting healthier. So is lifting weights. These are all passions of mine because I'm cheerleading for people for anything, for whatever they want to do for their life to, feel better, do better, learn more, have at it. And if plastic surgery is on that, dude, this girl's had some work, then have the work. Like, have the work and no shame. Like, no shame. I was plenty attractive before. I am plenty attractive now. To me, there's no difference. I'm only optimizing what like gravity is taking away from me. Gravity has more energy than I do. I'm only optimizing those kinds of things, and I personally enjoy the process of the maintenance of taking care of myself. It's just something. It's just part of me. It's an expression of me in my life. So maybe you have a reflection.
It's interesting because I would pose a question for you. Given where you live and the environment you're in and where you work, this is part of who you are, right?
Conceivably,
And
yeah.
yeah,
I'm an outlier. I think I'm an outlier, even in this world, for sure.
yeah, you are for sure. And I would say for us, like, and I look at it too here of being here, it's like where like um where's that when I'm considering something, like when I had my rhinoplasty done, it's like, why am I doing it? What am I going to get out of it? Like, what is the drive here, right?
Yeah.
And And it wasn't something that was super normal. Like it wasn't something I was around, right? So it was just like a big leap for me, and it just took time to like understand like what is the reason and where am I and what's driving this,
Yeah.
and it's just like, you know, and then the question later was like, why did I wait so long,
Why did I
right?
wait? Yes.
And that
Yes.
is and that, you know, we were talking about the shame piece, and I was like, I think it was like shame, right? Because I'm like, well, like I, you know, I don't want to do this, like I don't need it. And then afterwards I was like, oh my gosh, my allergies changed, my breathing
Oh, mine
changed,
too.
like it's just
Oh
like
yeah,
it was such a
totally.
huge shift, and
Yep.
it was myself holding me back, and it was my shame that was holding me back. And so sometimes it's not the question of like, um why do it, but it's like, why not do it,
Right.
right? Like
Yes.
what is that? And then it made me realize, I'm like, and now when I think about things like, you know, with my knee, I was like, I want to get this done as soon as possible because I know that it'll make my life better. Like,
Yes.
and I want to get the most mileage out of this. Same thing, like, and to your point, when we were talking about the like the younger, like when someone has a, you know, a rhinoplasty at a younger age, because it's such a personal issue for them to be more confident in themselves. It's like get the most mileage out of it, right?
Yeah.
Like,
Yeah.
and so for
Yes,
me, I
definitely.
guess
That is definitely true. Sooner rather than later, for sure on that. Yeah.
exactly. So this conversation reminds me that like, um it's like, you know, I don't want to, it sounds funny when I say this, but you know, like when you redo your kitchen in your house, always after, I know it's a painful process, but when you do it, you're
That's
like,
right.
oh man, why did I wait so long?
Why did
Right?
you
Because
wait so
they're,
long? And no one's like, why the hell did you do your kitchen? Your kitchen was fine. Why
yeah.
would you need to
And
do your kitchen? No one
and you
says
get,
that ever.
no,
Ever.
and you get so much joy from it, right? And the same
So
thing can
much.
happen here. And it's like, sometimes it's the me that's holding me back, right? It's
Hmm.
me that's like prolonging. And you even said for this one, you're like, I've waited a long time to do this,
Long
and for
time.
many reasons you did. And
Yeah.
I was just like, get it, like when you said you're filing, I was like, oh thank goodness, like it's like get it
Just
done, because
do
I
it
know
because
it's
I've
been
been
on your
talking about it
mind.
and it's
Right.
annoying. Yeah.
Yeah, and not annoying, but I'm like, and
Thank you,
I
Rachel.
trust, you know when you're ready. But I was just like, I was like cheerleading you on, being like, that's amazing. I'm so glad you're getting it done, because I know it's going to have a just such a positive effect on you, and you're going to be so pleased with it. There's not going to be a moment, you know, and there will be, like I always have this after surgery, I'm like, oh my god, this is the most painful, like, you know, there's a moment of like, this is the worst. I know I go through that every time, I just
Yeah.
know it, like whatever
Yeah.
it is, like,
Yep.
you know, it can be everything, like my knee or, you know, whatever. I'm always like, oh, this is terrible, why did I do this? And then afterwards I'm like, oh my gosh, I'm so glad I got it done. But that's just part of me, of like hitting that bottom part of like, this is painful, this is uncomfortable.
But that's an
And then,
actual, there's data on that. That's an actual thing that happens for people.
yeah,
Yeah.
and know that that's going to happen. But
Know
when
that,
you come
yeah.
out and when you recover, and that recovery can be short or long, that can be easy or challenging, you know,
Right.
when you get through it, like for me, it's always been such a positive thing of any way I can take care of myself for the right reasons.
Right.
And to realize that sometimes holding back, there's probably a shame piece there for me. And
Yeah, I love the shame piece. I know we can't talk for 2 hours on this piece,
yeah.
but let's just wrap in here because the I'm reminded of a girlfriend of mine who shall remain nameless, who was talking to someone about a decision that she had to make, and the guy said to her, "What is your aversion to happiness?"
Mm-hmm.
What is your aversion to happiness? Because she was fighting so hard to stay in a decision that was causing her so much grief and so much pain and so much, demoralizing feelings and, self-esteem issues and all the it is a plastic surgery version of this, right?
Yeah.
That has stuck with me so strongly. And I ask myself that often. What is my aversion to happiness? Why am I so willing to put up with so much? Why am I so willing to be, the strong one, the one that's, oh, I'm not going to do it. I'm just, my friends don't do it. I don't want to do it. And, it's whatever. Jane down the street can't afford it. I don't want to, be the one in our group who, whatever, whatever, whatever. But the concept is really, it's such a personal decision. And we've had the discussion about friendships. If you are around friends who can't support these decisions that you want to make for yourself, get new friends
Yeah,
tomorrow.
that's a good point.
Tomorrow. Because if they are threatened by who you are becoming, or your desires for your life, or your willingness to expand yourself and become the version of, we're always talking about this, putting yourself into the version of who you want to be. Where are you going? I always have avatars in my mind of women who I respect so much, personally, physically, academically, intellectually, career-wise, whatever. I always have an avatar, and it's easy to make decisions that way because then I say, oh, would so and so, would Ruth Ginsburg do this?
Yeah.
Would she think about it this way?
Yeah.
Or anyone that I admire, physically, would Jillian Michaels,
Yeah.
would she do this exercise this way? Would she skip these 14 workouts? Like no, she wouldn't, So yeah, I think just being able to be comfortable knowing that, also knowing that whoever you're seeing on TV that you think, oh, they look amazing. Oh, I don't have anything done. Da, 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 da. Ignore that. It is likely not true. And even if they haven't had anything done, their photos that show up on the internet have had things done to them.
Yeah.
So you can say, I haven't had anything done, like all you want. And even when we're watching TV, I was watching something the other day and I said, I was like, God, I was like, she looks different. Like, I don't, and then I was reminded that now we have AI for all of that stuff too.
Ah,
So even
yes.
when you're watching a talk show and you think you're watching a talk show and you think you're just watching the person in real life, one, you're watching
Mhm.
them digitized and, optimized and whatever for film, but which you always look better in film. Just think about your wedding pictures. You're always looking way better in your wedding pictures than you're ever looking in just real life. And you're not a
Yeah.
different person. It's just that the lighting comes a certain way and this comes a certain way. So say you're going on The View and you're like, wow, she looks really good. Yes, because everything is geared toward making them look good.
Mhm.
That is the point. So it's not real. It's not
Mhm.
real. But what is real is you looking in the mirror and deciding, I I don't like that I can't, see that
Right.
the hoods of my eyes are literally halfway down my iris. I don't like that I have jowls here and, I look older than I feel, like I don't like whatever. And there are money investments to be made, there are decisions to be made, there are all those kinds of things. But as we both of us here would agree, if there's something that you're thinking about and it's for you,
Mhm.
find the way to do it sooner rather than later because you are going to, just like getting your kitchen done, you're going to enjoy that kitchen for the entire time. I did my kitchen 15 years ago. I don't think I will ever redo it again. I'm not that person. Like I'm not like, oh, and then I need to do this. And then I need to do this. And oh, can I just do another one of these? And that's why I say I'm an outlier.
Mhm.
I'm not, I love it for people. I'm not like, I also love looking a certain age. I
Yeah.
don't need to hang out with not my cohort. I love my cohort. Yeah. So I just think there's so many things to talk about in this, and I just wanted to bring forth my little story and my little experience this last week of having a lower bleph, having an endobrow, having a recovery situation, having just any little pieces. I had a little lipo in this one spot that drove me crazy that I was like, can we do this? And they're like, yeah, it's like not even a thing. But I was like, but is it a thing that you can do?
Right. Right.
Like, yeah, okay, sure. Yeah, it takes 12 seconds. Like that's not a big deal. So even stuff like that, when, yeah, you're just fighting yourself, you're fighting the world, you're, you know, I don't know. Like you want to be natural, but then you want to drive the most advanced car. So it's like you have to kind of check yourself at every, right? You're not out there with a horse and buggy, are you?
Right.
Right? I mean, you're not saying like I'm not going to use lights unless you're Amish, and good on you, right? So I think that's like there's just so many logical ways that you can approach this, and that you can be kind to yourself in these decision making process. The biggest way that you can be kind to yourself is to do your research not on Instagram, please, not on Instagram, but on ways that you can see people's actual results. You can see people in real time who've had real surgery, who don't have cuts all over their face, who don't have, obvious looks, who don't have windswept
Yeah.
anything, who don't have, if they look amazing, the chances are they've had really good plastic surgery. Honestly, at a certain age, if they look ridiculous and you're like, wow, you look so good, the chances of them having had really good plastic surgery are probably 80%, truthfully. So just to encourage
Well,
everyone, and just make sure everyone knows that, that
yeah.
that's real.
And I appreciate, Chris, you bringing this topic because it's a vulnerable place for you to come from right now because you're in the middle of recovery
Oh
and you're
yeah,
sharing your
totally.
personal story. And I really appreciate your openness and your willingness to share this because it is, you know, that I think can help with some of the shame piece for people, right? And that's the whole
Yeah,
point of this is like the grateful, not greedy part of it plays in here of like doing it for the reasons for yourself, for the right reasons, without shame, and knowing what it is that you want the end result and not, snowballing along the way of just like get here and there and there and there. Then it becomes, you never get off that wheel.
well, that's the
But
greedy. That's the greedy. The
that's the
greedy
greedy
is
part,
like, yeah.
right?
What else?
And
What else? What else? What else? Yeah.
removing the shame to have the grateful part, right?
Yeah.
So all of those pieces, I do appreciate that. So thank you.
Yeah, and thanks for saying that, because it's just as easy for me never to talk about it. It's just as easy for me just to, kind of be chilling and doing my life. And, I don't see that many people on any given day. Like, I'm a pretty private person. I kind of just go about my life. So, but being able to be a champion for women and for men, because men, there's a lot of great stuff that men get from having a
Yeah.
facelift,
Yeah,
from
for sure.
having having little tweaks done for them, getting little body procedures or whatever they've got going on. There are men that benefit from it. Obviously we have there's a whole life of transitioning situations that plastic
Yeah.
surgeons deal with. There are the teen rhinoplasty thing. I just can't say enough about that. I can't say enough about that. If you are a parent and your child is asking you and you are looking at your child and you can see what they are talking about, at least just take them for a consultation. Just at least, because that is something that will literally alter the course of their life.
Mhm.
If that's another issue, right? Maybe you're like
Right.
holding on to like, oh, but I want them to have my nose and I want them to have this. And, they might not even have your last name for your whole life. So it's like, what
Right.
about, like, why the nose, So yeah, so thank you for saying that, because I guess it's not easy to talk about, especially when you don't know who's listening, right? It's
Right.
easy for me to talk. I'm sitting here talking to you, and we're just having this conversation. I'm like, oh, hey, and Rach, and this and that and the other, And when you reflect, well, people will take this information, and people will judge, and people will, I have plenty of haters. I've said it before. I don't even know why. I'm just a person. I'm just living my life, whatever. But everyone's got their own agendas. But being able to kind of bring it out, and
Mhm.
when I say DM me, I mean DM me. I will answer you. I will answer you. I will help you, because it is a passion of mine, and I don't want people to be misled in this great, amazing specialty of aesthetic medicine, plastic surgery, and there are very skilled operators out there who can help you, and there are also unskilled operators who will not help you and who will cause you to have subsequent operations that you probably then cannot afford. So just that it's a whole crazy train that we all get in. So thank you, Rach, for listening.
Thanks, Chris.
And I
Yeah, thank
appreciate
you.
you going through this with me. And this is probably a topic that we'll bring up again, because we didn't even get to touch on just
Yeah.
beauty as a concept, like what is grateful, not greedy, the beauty version? How do you support your daughters? How do you support your sons, you know, with other women, like how do we have that conversation so
Yes.
that is not the driver? Because as I've said, I'm a whole person. I'm developing every aspect of my life. This is one thing that I do among many things that I do to optimize myself as a person. So
Yeah.
it's just important for people to understand the whole big picture. So with that, Rachel, this has been
Right.
lovely. Thank you so
Thank you.
much. And this has been, is, and forever will be the I want to say something else, but I'm not going to say it. The Grateful Not Greedy, Not Greedy, Grateful Not Greedy podcast. And aloha, Rach. This was really fun.
Aloha, Chris.